Hi, my name is Ashwini Zenooz. I am a physician. I've been here at Salesforce a year and a half, and I am the Chief Medical Officer, and I lead the Healthcare and Life Sciences Industries team. We're seeing challenges that are impacting each other across different industries. So I would say I would bucket these into three big areas. The first challenge we're seeing is our disruption to the medical supply chain. And so things like gloves and masks and even simple things like nasal swabs are being impacted because of the disruption and the imbalance of supply and demand. The other big challenge we're seeing is the impact on the workforce with leading to shortage and overall capacity. So what I mean by that are our frontline staff, our healthcare workers, the people that are working in the hospitals. The third big bucket I'd say that I find really interesting is we've had an increase in call volume to our call centers. And this is, again, across our industries, but definitely for us and payers and providers. Our call center staff are reporting that they're not just answering questions like traditional to healthcare, but they're having to answer about food and fuel. What if a family member that they're with is, having symptoms? Do they have COVID? Or I'm in isolation, and how do I get meds to me? How do I get this transported to me? So lots of questions that are on the periphery of the normal, I would say, normal triage of a call center. And so it's been helpful to us to work with our customers to see how we can help them. We're seeing the government responding, and so the White House has expanded Medicare coverage for telehealth benefits. HHS has suspended HIPAA for audiovisual here in the United States. We're seeing a huge uptick in telehealth. UPMC, for example, reported going from 80 to 500 visits a day. So a lot of solutions coming out from our partner orgs working with us to provide these solutions. One, definitely reach out to your partner account manager. As you know, we've taken some steps here at Salesforce as well on how we're going to respond to this pandemic. You've all heard from our CEO, Mark, who's put out his blog and his letter to the customers. We've also released some technology that we're giving out to help our customers during this time, where we have packages like Quick Work from Home. You've seen the new one that's come out for Salesforce Cares. We have a solution that's coming out now for healthcare that's specifically to help with PHI data. So, if you have a HIPAA compliant or a PHI compliance that's required, we've put out a solution. So definitely reach out to your PAM so you can get a demo org and you can work with us in bringing these solutions to your customers. Tableau has a live data tracker. It's for public use and it's free. The Johns Hopkins University also has a live tracker of confirmed cases. Watch out for LinkedIn and tweet posts and Salesforce blogs for more up-to-date information on this stuff. What has it meant for me personally? That's really interesting because, I do love my children, but what I've realized is I'm not a very good stay-at-home teacher. For 3 weeks now, we've been homeschooling our kids, and I definitely am not as good at geometry and arithmetic like I used to be. So that's a change. I'm learning new things all over again. We've had a really good inflow of ideas from our partner community, hearing from all of you daily. Just want to thank everybody for everything you're doing, whether you're a frontline worker or you have a family member that's out there or you're doing another form of service. Everything counts. So appreciate all of us working and getting through this as a community.